Our two primary goals of using histotripsy for osteosarcoma ablation are, one, to ablate the tumor in the bone, and our second big goal is to use histotripsy as an immunostimulant. So in some sense, the possibilities are almost limitless.
Welcome to Curing with Sound, a podcast presented by the Focus Ultrasound Foundation. I'm your host, Allison Preston Smith. While we mostly hear about focus ultrasound being used in the treatment of diseases and conditions affecting humans, research is underway to use focus ultrasound for animals as well. Our cats and dogs are exposed to the same environments we are and can develop the same diseases as us. Now, treatment may be similar too. Dr. Joanne Tuohy, Associate Professor of Surgical Oncology at Virginia Tech's Animal Cancer Care and Research Center, investigates the use of non-invasive focus ultrasound to improve cancer outcomes for veterinary patients. She and her team have been focusing on using histotripsy to ablate tumors in dogs with osteosarcoma, one of the most common types of bone cancer. In this episode, we also spoke with Tasha Hoover, whose dogs participated in two of Dr. Tuohy's clinical trials investigating focus ultrasound for osteosarcoma. Welcome to the podcast, Joanne.
Thank you for having me.
What made you interested in using focus ultrasound in the veterinary field?
Yes, I came across the concept of focus ultrasound a number of years ago. I have been very interested in ablation technologies. I'm a veterinary surgical oncologist and understand firsthand how surgical treatments can be very effective, but also sometimes can be limiting. And for all our patients, at the bottom line, surgical treatment is invasive. And so my interest in ablation technologies was exploring another avenue of treatment for tumors that could perhaps be less invasive or non-invasive.
In your research, you use histotripsy. Why do you prefer that mechanism over something like thermal ablation?
So histotripsy is a type of focus ultrasound technology that aims to destroy cancer cells or any cells in its focus without the use of heat. So unlike other ablative technologies that commonly use heat to kill cancer cells and other cells, histotripsy uses mechanical stress and pressure instead and breaks down the cells that are in its focus or in its path.
What are some of the current limitations or challenges that you face when implementing histotripsy in the veterinary setting?
I think that for one, a device challenge would be something that I think about. Veterinary patients tend to come in many different sizes. The size of our large dogs, for example, are closer to human sizes, but then dogs also and cats, they come in small sizes. So developing the flexibility of these delivery systems for size accommodation, I think is one important challenge and a good one to try to solve for our veterinary and human patients.
How do you see focus ultrasound also benefiting veterinary medicine more broadly?
So I think in some sense, the possibilities are almost limitless. For example, in the field of ablating urinary stones, I think that is definitely an application that is much needed and can help our dogs and cats, and then also people. For example, I've seen papers of focus ultrasound potentially being able to ablate cardiac conditions, and so I think that is another avenue. the ability of focus ultrasound to be able to aid in ablation of, say, neurological conditions. So where focus ultrasound potentially doesn't only restrict itself to high intensity, but perhaps even low intensity focus ultrasound, which I think is another exciting area of study, its effects on pain, on neuromodulation. And so I think there are so many possibilities out there. And as I said, I think it's exciting, and I hope that many different people will take those opportunities up and try to develop it further for other non-cancer applications.
Can you tell our audience about your current clinical trial for osteosarcoma in dogs?
My engineering collaborator, Eli Vlasavovich, and myself, we embarked on this journey to develop Histotripsy for ablating osteosarcoma, as you mentioned, a bone cancer. Bone is a material that can deflect ultrasound. And so being able to have the engineering capability and refine the histotripsy parameters to the point where we can ablate these tumors that are within bone, so they're harder, they're not as soft as, say, liver tumors. So many dogs are affected by osteosarcoma, which is a very painful disease and also very aggressive. And unfortunately, people, especially children and teenagers, are also affected by osteosarcoma in very similar ways. And so we started this journey knowing that there are challenges, but really wanting to move the technology forward to be able to ablate osteosarcoma. And our two primary goals of using histotripsy for osteosarcoma ablation are, one, to ablate the tumor in the bone. So that means that if we can eliminate the tumor within the bone, then we could offer a non-surgical limb sparing technique that can help dogs and people preserve their limbs and not have to undergo surgical resection of the tumor. And our second very overall big goal is to use histotripsy as an immunostimulant, as has been shown in preclinical studies, so that we can not only have histotripsy stimulate the patient's immune response, but also create synergism with other immunotherapies, which unfortunately to date have not been effective at treating sarcomas like osteosarcoma. And I think that combination, histotripsy and immunotherapy, has really high promise for increasing the effectiveness of the immune response against the tumor.
So how can families learn more about your clinical trials and patient recruitment?
So through our university website, where people can go to the clinical trials website at the College of Veterinary Medicine at Virginia Tech's website to look for specific clinical trials, and the histotripsy clinical trials are listed there. And we currently are recruiting for canine osteosarcoma patients, so dogs with osteosarcoma in their legs. These studies are also combining histotripsy with an immunotherapy, which is also particularly exciting. We have a clinical trial for dogs with oral tumors and also a clinical trial for dogs with liver cancer. And these two trials are much newer, and so we're excited to move them forward as well.
Thank you so much, Dr. Tuohy, for sharing more about your work and the important research you and your team are doing.
Thank you so much for having me. And I also want to thank the foundation for a lot of the support that they provide for our work.
Welcome to the podcast, Tasha.
Thank you for having me. It's good to be here.
So you have 2 Dobermans. Can you tell me about them?
Yes. I had Hunter previously, and I have Princess now. I also have Shep currently. But Hunter, I got as a puppy from a breeder. He kind of picked me. Princess came to me a little differently. She's a foster fail.
Does that mean you fostered her but got a little too close? And
Well, I think I was done from the moment I met her. When I went to pick her up, she kind of sat there and looked at me, and it was just like, oh my gosh. So yeah, I fostered her for a little bit and then decided she needed to stay with me.
Oh, well, tell me about Hunter, your first Doberman that you had. What did he like to do? What were some activities you did?
He was definitely a couch potato, hung around a lot. He liked to play ball a little bit, that kind of thing. But yeah, he was just a little bit more of a mellow kind of guy.
How did you first learn that he had osteosarcoma?
He was limping. And he was about 7 at that point. So they thought maybe arthritis. And then, tried some pain management, that sort of thing, and then kind of dug a little bit deeper because it was still, having an issue. He was diagnosed with the osteosarcoma.
What were the treatment options you were given when you talked to the vet?
So gold standard is amputation, chemotherapy, or your other option is palliative care.
And how did you first learn about focus ultrasound for osteosarcoma?
So, there's a couple of places that I was recommended that I could go. There was a place, I believe, in Richmond, or they could refer me down to Virginia Tech. And being familiar with Virginia Tech and a fan of their programs, I decided to go there. And that's when I met with Dr. Tuohy and her team, and she explained this treatment option and the clinical trial that she was going through. It was something that I really wanted to get involved in.
Yeah. Was there anything about focus ultrasound that just seemed like a better option than the typical standard treatment for osteosarcoma?
Yes, definitely. I like the idea of, amputation obviously takes the cancer away, the tumor away, whatever. But I really like the idea of the focused ultrasound being able to kill that tumor and the cells first.
Mm-hmm. What was it like meeting the researchers and hearing about the clinical trial?
Dr. Tuohy is so thorough and so informative and so patient, because I was very shell-shocked. And after sitting there and talking to her, I really felt so much better. I felt like, yes, there's hope here. There's maybe some new options, new treatments. So I was, definitely feeling, much more better. At that point, my only hesitation was, the actual amputation.
Gotcha. And so how long did the whole process take?
So there was a full day of running him through the tests for the metastasis, his heart, blood work, all of that. So that was a whole day that he was down there for that. And given that everything was cleared, then he went back down the next day and they did the focused ultrasound treatment and the amputation. And the day after I picked him up and he came home.
And how did he respond to the treatment?
It didn't seem to faze him at all. Obviously the surgery, amputation, that kind of thing was but the actual ultrasound, focused ultrasound part of it didn't, faze him at all.
And you also have another Doberman, Princess. She was also diagnosed with osteosarcoma. How old was she?
She was just turning 4.
Oh, wow.
Yeah, she's a young one. Mm-hmm. I know.
Yeah. What did you notice with her? I mean, was there a change with her behavior, or did you notice the limping again?
So with her, it was really kind of weird. She would just have a random yelp, just out of the blue yelp. And then it started getting a little bit more like at night when she was rolling around or moving or something, she would yelp. And so I took her in for some x-rays. They were kind of inconclusive. So then we sent her out for an MRI, thinking maybe it was intervertebral disc disease, something with her neck is kind of where we were leaning. And the MRI diagnosed osteosarcoma.
Did you know right away that you wanted to pursue focused ultrasound treatment again?
Yep, I wanted to head back to tech and see, Dr. Tuohy and what she was up to these days.
Mm-hmm. And so Princess participated in a different clinical trial from Hunter. Do you know what the differences were between those trials?
So Hunter's trial actually kind of helped shape some of the new protocols for Princess's trial. And now there's 2 trials, one with amputation, one without, using the focused ultrasound. So I chose still to go with the amputation just because I feel like that takes the cancer completely away. But the ultrasound treatments this time are a little bit more different. It's not just a single treatment. It could be multiple treatments based on the size of the tumor. And before they would do the treatment and then the amputation right after. Now there's a little bit of time waiting period, to actually give that a chance to, get in there, do the, kill the cells and that sort of thing.
And how did Princess adapt after the amputation and focused ultrasound treatment?
So she came home after the treatment. It didn't seem to bother her at all. She didn't have any swelling or any issues or anything like that. And then her amputation, my gosh, they called me that evening, to check in with me and give me an update. And then she said she was already up and going out and all that kind of stuff.
Oh, wow.
When I went to pick her up, I could hear, she's really bad for pulling on the leash. I could hear her pulling them down the hallway to come to me. And I was like, oh my goodness, it's like, leg, what leg? So she's adapted really well.
What does it mean to know that Hunter and Princess have contributed to research that could help other dogs and maybe even other people?
I love the idea. To me, it's kind of taking a bad situation and finding something good for it. And I love that, Virginia Tech is not just working with animals, but this is also animal and human research. And, I had no idea with Hunter that he would one day help another dog of mine. The hope is that, with these treatments, these dogs can live longer, possibly a cure. And then, of course, certainly, if that can be translated into, more help with humans, that's, all the better, because it's just cancer is an ugly disease.
Well, thank you so much, Tasha. It's been so great talking to you. And thank you so much for sharing about Hunter and Princess and their contributions to the research field.
I thank you for having me. I truly wish that I wasn't contributing, but, if I have to go through this, I'm glad that, that some good can come out of it.
This episode of Curing with Sound has been presented by the Focus Ultrasound Foundation. If you'd like to learn more about Focus Ultrasound or the Foundation, visit our website at fussfoundation.org. You can also sign up for our newsletter and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information about Focus Ultrasound. You can also rate and review the show.